So I thought we would try something different for today's podcast. As always, I'm joined by ASN Regulatory and Quality Officer David White. Hi, David.
Hey, Todd. How are you?
I'm doing well, thanks. We're also joined by ASN Manager of Congressional Affairs, Zach Kribs. Hey, Zach.
Todd, how are you?
I'm doing well, thanks. So for today's discussion, I thought we would start with you, Zach, and just get a sense as to what you think is going to happen between now and the end of the year in terms of the congressional activity. So you oversee what we do with the House and the Senate. Just curious as to what you see, and then as we think about next year, what we should be worried about. So what are the priorities for Congress over the next couple of weeks?
Thanks, Todd. Yeah, I think that to understand the next couple of weeks, we really do need to understand the election. And I don't think we want to go too deep into this, but I think the first thing to really understand is the Senate has, I think at this point, pretty securely been called for Democrats. They're expected to maintain at least a 50 seat majority because the Vice President, Kamala Harris, is a tiebreaker. They may actually even gain seats over they're standing in the 117th Congress that we are concluding this year. And so I think with this extra advantage in the Senate and at least security that Democrats have that they will remain with the same majority, they're going to focus a lot less of their time on Senate or in the Senate on judicial nominations, which they were really gearing up to do for the remainder of this lame duck period. And I think we'll see them probably focus a little bit more on the policy agenda of the White House and really trying to do everything they can to set themselves up to be in a good place for the next Congress. On the flip side of this, the House of Representatives is still being decided. I think it's very likely, and I think it's actually being called this morning, as of the time of this recording, that the Republicans are gaining control of the chamber. They're going to have probably around 221 seats, I think is what we're expecting. So a very small majority. I think this will mean that during the lame duck, again, Democrats will have a little extra energy to really get across all of these big priorities that may not be possible with a divided government. So I think we've seen things in the news about the debt ceiling and allowing the government to borrow more money. I think we're also going to see Democrats really want to try and wrap up appropriations for fiscal year 2023 this fall and not leave it over to the next Congress. And we may see some additional priorities that the White House signals as well as that are important.
Zach, from the perspective of kidney health policy, what are some of the potential issues? So you mentioned appropriations. So appropriations would cover funding for the National Institutes of Health, funding for the Food and Drug Administration, the CDC, the Department of Veterans Affairs, the Health Resources and Services Administration. Beyond appropriations, some other also funding for Kidney X. Thank you for calling me on that. So let's just start there. What do you think is likely to happen with Kidney X funding?
So Kidney X funding was proposed in fiscal year 2023, which is again the fiscal year we are currently in. The fiscal year doesn't match up exactly with the calendar year. And the funding proposed was at $5 million, which was consistent for this fiscal year 2023, which was consistent with the year previous. So Kidney X is actually in a really good spot. I think no matter how much of an increase the House and Senate agree to for appropriations, there will be a consistent $5 million for Kidney X. I think similarly for some of the other programs we care a lot about, such as research at the NIH, specifically NIDDK, chronic disease surveillance at the Centers for Disease Control, and making sure the FDA has a strong regulatory approval pipeline. All of that funding, I think, will possibly maybe not get as much of an increase as Democrats were hoping for. But I do think Democrats are going to push to have it hew as close to those numbers as possible. I think the big open question right now is COVID funding. The Biden administration, I think, is preparing, per the last that I read, a $10 billion COVID relief request for this fiscal year. This is tricky because the next year, again, with Republicans in control of the House, I think they're not going to want to spend a lot of money on COVID, if any, and maybe even try and claw back some of the money that's already been spent on COVID. The White House really has one shot here to kind of get all the funding they need for the next 2 years for COVID policy and COVID safety.
So it sounds like, from an appropriations perspective, the issue is going to be around amounts of funding, and then also the issues around funding for COVID-19 policies. Beyond these, I know one of the big issues for the kidney community is a legislative solution to the decision by the Supreme Court in Marietta versus DeVita. Where do you see that headed in this Congress?
That's a very interesting question, Todd. I actually want to broaden this a little bit. For the avid listeners of this podcast, will know that the Supreme Court changed policy in June that changes the way Medicare and private payers pay for the coverage, primarily for dialysis, but for kidney failure more broadly. I think this issue is actually alongside a number of other Medicare payment issues that Congress is considering. And there's a lot of pressure being put on Congress by professional societies in particular to address some of these essentially payment cuts that physicians are facing. And I think David will have some more insight too into kind of the ins and outs of some of these Medicare policies. The long and short of it is Congress is getting a lot of pressure to fix some things that are broken in the Medicare system, or at least that physicians are telling Congress are broken in the Medicare system in terms of payment. But these fixes are going to be expensive. So I think that the legislation that would address the Supreme Court decision, if it is scored as a saver, which is still something that's being decided by the Congressional Budget Office, I think I would expect to see those three policies, combination of these policies, move together in an end-of-year Medicare payment package. But the writing is still not on the wall. I think there is a lot of dusting that both Democrats and Republicans are doing after the election to see kind of where all the cards are falling. So this is still very much an open question. And again, another important reason for our members and for the physician and health professional community at large to continue to pressure Congress into creating a solution to these payment cuts.
You said something there that I'm interested in and just wanted to ask you about, because you and I both have been dealing with this for quite some time. There's been a set of Medicare physician fee schedule cuts and also clinical labor cuts that are getting to be pretty severe because of other things that are gone up so much within the Medicare physician fee schedule that kind of force other things to be cut because of budget neutrality. Do you think that there's a chance that Congress will act like they did 2 years ago to delay those cuts again? If you were a betting man, and do you think there's ever going to be a time when Congress might re-examine the budget neutrality side of what they created for Medicare?
Two very big questions. This is frankly not a bet I'd like to take or really put any odds on.
Okay.
I think a mathematician would say the odds of anything happening are 50-50. However, I do think it's very unlikely for budget neutrality to be done away with by a Republican-led Congress. I don't think it's such a big policy that I don't think there's going to be time for this to happen in the lame duck either. So I could be surprised. I could be very wrong on this, but I don't expect the budget neutrality piece to be revisited anytime soon. I do think, again, there is a lot of pressure on Congress right now to address the physician payment cuts. I think if you speak to anyone who's working in a hospital setting, they'll tell you about how understaffed they are. If you talk to anyone working in a dialysis clinic, they'll tell you the same issue. These labor shortages are a very real thing, and they are starting to impact care. And Congress really wants to be responsive to this. So I do see that there's a lot of interest in pulling together a package. There is legislation, a couple pieces of legislation that are out there right now that would address some of these payment cuts. The question is how much leadership decides to prioritize this. And frankly, we just haven't had enough time between the election and now to see where leadership is moving on this, how they're thinking about this issue.
Thanks for that.
So, David, shifting from the legislative branch of the government to the regulatory branch, what do you, or I guess the executive branch, but regulatory policy, what do you see is likely to happen over the next couple of weeks and months?
Well, Zach, he was spot on in what he was saying just now. Zach, I mean, we are definitely seeing a lot of concern from ASN members about where the labor shortages and just overall workforce issues are beginning to impact the system. And we're seeing some real significant problems, particularly in dialysis facilities, about expanding capacity for increased number of incident patients and those who might have AKI who are in the hospital, and they're trying to discharge them with coverage in center somewhere. And that's it's really beginning to get very tight. And the thing that's a problem is Zach is absolutely right. I don't see Congress changing the budget neutrality piece to this, but the catch is the way both the whole physician fee schedule is structured and the Medicare ESRD benefit is structured, it's just not agile enough to handle the massive inflation of both of everything and also of labor cost. And it's kind of like reaching a breaking point. And, we're all trying to have that conversation about if Congress fixes it, that's great. If they don't fix it, what can CMS do? And that's something that's still being really investigated. I wouldn't take anything off the table. So that's really kind of, I know that's just kind of like kind of vague, but right now, Zach is right that the real power is in Congress to do something to fix this problem. And there's far less authority on the regulatory side to do anything absent of that support from Congress.
David, you really remind me of a third point. I think that's both important for Congress's activity and also the regulatory agencies' activity. What is the White House's position on this? Where is President Biden and his cabinet on some of these issues? I think their direction is really going to be important for both House and Senate Democrats in particular. And of course, it's going to be important for the regulatory agencies as Biden is their direct boss. So I think really understanding where they fall on some of these issues and where they prioritize it in kind of the kitchen cabinet of all these other things going on in America, I think that will continue to be a really important signal for how this gets done.
Yeah. And Todd, feel free to jump in here with me, because we know what I'm going to say first and foremost is you're not going to see any significant changes in the way Medicare or HHS is being run. Republicans in the House might want to and make some changes, but the administration itself, barring that, is not going to be interested in doing an about face on pretty much any of the things they've done, which is really focus in on equity and really try to examine how HHS and the healthcare system really does meet the needs of everybody or doesn't meet the needs of everybody. Where are those gaps and how to fix them? So that's going to continue to be a very big issue. And we're going to see, I think, even more of that. And we've seen it in the last year or so, that we're looking at just a whole set of levers that the administration is trying to pull to make sure that they address equity and that we really are talking about making sure that the care is affordable. As you know, there was a big jump in the Affordable Care Act market of those plans. There's been a big jump in Medicare Advantage plans that are available. And even as you and I were just talking the other day, there's been increased interest once again from Senate Democrats about kind of overseeing what Medicare Advantage is doing in practice. So there's a lot there that I think we're going to continue to see really being dug into deeper by the administration.
So if I try to pull some of these threads together, it seems like over the next couple of weeks, the lame duck Congress from the 117th Congress, as they finish up, with the Democrats having the majority in both the House and the Senate. Granted, they're thin majorities, but they do have a majority in both. They're going to try to focus on the debt ceiling so that that's not something that has to be dealt with in the future. And getting appropriations for fiscal year 2023 completed. And as Zach said, the fiscal year started October 1st and goes through the end of September of next year. That's FY 2023 from a federal perspective. And then there may be a couple of other priorities. And one of the issues will be how the potential legislative solution to the decision in Marietta versus DeVita, if that projection is positive, then that may be something that gets over the finish line. We didn't have time to talk about the Living Donor Protection Act, but that's another issue that potentially could be addressed. But then as we step back and we start thinking about next year, when there's going to be a split, so a Democrat in the White House, Democrats with a thin control in the Senate, and Republicans with a thin control in the House, the big issue is going to be around the Medicare program, what budget neutrality is going to look like, in the sense of that there seems to be, with the inability to spend more in the sort of Medicare arena, real challenges, particularly with labor shortages among health professionals, but other issues. And then the Biden administration's focus on healthcare equity and sort of further expansion of the Affordable Care Act. Is that a reasonable, I'll go to you first, David, and then Zach. How would you react to that quick summary of the discussion thus far?
I think it's pretty spot on, and I think it's an accurate outline of kind of where we're going. Zach might have some other additions to it. I think really on my side over here in the regulatory space, we in the next couple of weeks we're going to see CMS watching very closely what Congress does to figure out what its direction is going to be as this Congress winds up, and if it does address any of these particular issues. And if not, then we're going to be having some pretty, hearty and healthy conversations within the HHS system about some of these issues. How about you, Zach?
I wholeheartedly agree. I think the next couple of years are really going to be interesting because of the structure of Congress. I believe we're really going to have 2 years of essentially a lame duck Congress. And I think a lot is riding on how the White House decides to shift its priorities, if at all. This is very common after a midterm that the White House will respond the way they do policy to make sure they have the best chance of winning the next election. And I think that's going to be on the minds of just everybody in the Democratic caucus broadly. And look no further than the Senate, right? In the Senate in 2024, Democrats are defending 21 seats, many of them in deeply red states. If you look at Republicans, they're only defending 10 seats. Their most competitive seat right now is probably in Texas. So there's going to be a lot of interest on both sides of the partisan landscape to show that they're doing as much as they possibly can for voters, really making that case again for 2024. But at the same time, the actual structures of how they go about doing this is going to be challenging because there is shared power. But I do want to leave on a hopeful note. I think there's a lot of opportunity here for people who care about kidney health. Kidney health is a very bipartisan issue, and I think that there's going to be a lot of appetite for some of these bipartisan and nonpartisan issues in Congress. And I think while the administration is definitely Democratic, I think that they will be looking also for areas where they can have kind of quick wins. So if we can line up support behind some of these many priorities of ASN and the 4 priorities of the United for Kidney Health campaign, I think we'll be in a good spot.
I agree, Zach. Well said.
Well, thank you, Zach, for joining us. And David, as always, thank you for continuing our ongoing conversation about these issues. I really appreciate it.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.